I would like to thank Chairman DeLaura, Ranking Member Cole, and all the members of the Labor, Health, and Human Services Education and Related Agents Appropriations Subcommittee for holding today's hearing. My primary purpose for testifying today is to urge the subcommittee to provide $10 million for the Center for Disease Control and Prevention's National Center for Injury Prevention and Control for Child Sexual Abuse Prevention Research Activities in fiscal year 2022. Specifically, the CDC estimates that 1 in 4 girls and 1 in 13 boys will become victims of child sexual abuse. This traumatic experience is associated with long-term physical and mental health issues impacting how children think, feel, and act over their lifetime. Regrettably, in 2020, reported by the Interpol found that the COVID-19 pandemic has increased the frequency of child sexual abuse and the consumption of online child sexual abuse materials. Further, the pandemic has provided abusers additional access to victims while inhibiting children's ability to access victim services, to report their abuse, and receive treatment. I believe that increasing funding for child sexual abuse prevention research activities will be a crucial investment in the continued fight to protect our most vulnerable population. This research will be used to clarify the risk factors that promote offending and the protective factors that prevent offending. Most importantly, this research will be used to develop and disseminate effective prevention strategies to ensure that evidence-based intervention practices make it into the hands of parents, educators, youth-serving organizations, and other stakeholders dedicated to keeping children safe from sexual abuse. Prior to becoming a member of Congress, I was engaged in advocating for children. On a personal level, my wife is a survivor. Her sister Kelly was a survivor who turned to opiates and who's no longer with us, who left 3 children behind. My wife wanted to be able to have uncomfortable conversations and make sure that children were educated about the prevention of child sexual abuse and that parents, educators, and children talked about prevention. We went into the schools. We talked to over 12,000 students, 12 through K, or K through 12, in a collaborative effort with the U.S. District Attorney's Office, the faith-based community, Child Protective Services, and other advocates for children. 73 young people came forward and were substantiated during that symposium that we did over a period of time. I bring that up because we used those outcomes to change a law or to pass a law in the state of Indiana, having an hour of curriculum about child sexual abuse, prevention, internet safety, and phone safety. I bring this up because as we went through that exercise, hundreds of survivors came forward and talked about the importance of how it impacted child trauma, impacted their lives, the inability to work, the inability to turn to addiction or to alcohol. So I bring this up to tell you that the No More Secrets campaign that we put together helped to aim and better understand and report abuse that that a child may experience. And so I appreciate this opportunity to continue to be engaged in this issue. And by advocating today before the subcommittee, I'm thankful for the demonstration of the subcommittee's commitment to investing in research to eradicate child sexual abuse in recent fiscal years, and I respectfully encourage the subcommittee to appropriate $10 million to this vital program for fiscal year 2022. I thank you again, Chairwoman DeLaura, Ranking Member Cole, and all the members of the subcommittee and the subcommittee staff for your dedicated work for holding this hearing. I thank you and I yield back.
Thank you very, very much for what is a really powerful testimony. And as we noted before, that it's personal experiences in people's lives that, on the one hand, and I guess tragically you saw the other side of that coin, Congressman, with I believe your sister-in-law, and you know, and how people cope with these. This is real tragic in a child's life, and what happens. But again, you know, and I've had the opportunity to meet your wife, but to take that experience and for the two of you, and to, you know, work with 12,000 students really is quite extraordinary. And you know, you in so many ways you save people's lives, you turn their lives around, and there isn't anything more important than any of us can do. And the whole issue of child sexual abuse and my sense is, though I don't have any statistics, you know, at my fingertips, is during this period of time, this, you know, with COVID, and you know that we probably have seen the increase of that of that abuse, we try to think about how we try to prevent it, but when we can't prevent it, how is it that we try to address the needs of these children? And you may have said, but 91% of child sexual abuse is perpetrated by someone the child or the child's family knows. That is what is so egregious about this issue. And I will just tell you that in 2020, the CDC did establish that new funding line. It was for $1 million. 2021, it's been $1.5 million. And what the CDC was looking to do is to research and evaluate the approaches to prevent adult perpetrated sexual child abuse. The line item is there. Let us work together to see about how we might be able to increase the opportunity to be able to increase the scope of the effort and bring solace to youngsters. What an unbelievable effect it has on their lives, and oftentimes their lives end in tragedy because of this experience. So, thank you for what you and your wife have done on your own to address this problem. But I know that we want to work with you to see how we can engage with the CDC and a federal response to increase the opportunity to bring these children to come to grips with what's happened to them and to be able to move on. So thank you very, very much. I look forward to working with you. I know we both do. Congressman Cole. Tom, yeah, unmute.
Thank you, Madam Chair. Although I usually perform better muted.